This is consumer-driven health insurance segment from consumers' doctor on the behalf of foremost organizations. So what is consumer-driven or customer-driven health insurance segment? Today's main topic is cost of care. How does the cost of care rates in the personalized health insurance aspect, so-called personalized health insurance or customer-driven health insurance? How does it fare? Cost of care can be lowered with segmentation by health status or health risks. There are group impacts, personal impacts to costs. Group and personal changes in behaviors can lower the use of medical services, lower the cost of care, reduce premiums, and offset our out-of-pocket expenses. Out-of-pocket expenses, yes. Then what is the problem? Problem is 90% of the doctors, hospitals have no idea what are the costs of their care. Or hospitals use so-called charge masters as a basis of negotiating prices with private insurers. Charge masters, folks. That's how they negotiate with private insurers. Charge master schedules are not related to actual procedural costs. They're not. They are prices, not costs, essentially made up fees. They are made up fees by the hospitals. Government insurance programs pay hospitals based on another artificial schedule, so-called DRGs, diagnostic related group. That's how they do it. Whereas doctors classify diseases based on ICD-10. What is ICD-10? International Classification of Diseases. That's a manual. Every year it's published. Doctors charge based on the ICDs and hospitals charge based on DRGs. Then doctors then charge fees based on CPT codes, so-called current procedural terminology. They charge the fees based on current procedural terminology, so-called CPTs. American Medical Association. The American Medical Association creates this proprietary CPT fees schedule. The public has no input in this. Public has no input. Competition is irrelevant. And free market forces are ignored. Free market forces are ignored. The CPT codes they form the basis for federal Medicare payments to the doctors. That's what happens. They also form the basis of negotiated amounts paid to the doctors and private insurance. Paid to the doctors for private insurance. Private insurance generally pay 20% more than the Medicare. Can you see now how these medical charges are rigged with insider terminology? insider terminology, and self-dealing amounts they can charge. They're rigged, folks. They are rigged. And public has no say. Public has no say. Did you know, for example, doctors cannot charge you less than Medicare? If you're a patient, they cannot charge you less than Medicare. That is because the government has contracts that require any doctor accepting it. They cannot charge anything less than Medicare because the doctors have signed a contract with Medicare. Medicare to abide by a clause as the most favored nation charges. So under law, federal law, doctors cannot accept less than Medicare fees from your private insurance. It is an insider's game using fancy formulas and mathematics to price fix and rip off American consumers. This is what is happening. Rip off the American consumer. In most cases, third-party payments like insurers, government, and employers distort normal consumer price influences. They distort, minimize pricing competition, and eliminate normal market pressures for transparency. They eliminate normal price transparency. What is the solution? The solution, despite the forces working against you, you need lower insurance premiums. That's what we all need, lower insurance premiums. How can you influence lower insurance premiums, you may ask? How can you as a customer can lower insurance premiums? Well, insurance premiums are made up of medical procedure cost versus utilization. It has to be based on procedural cost and utilization. Utilization is the number of times a medical procedure is used. Consumers may not be able to directly set or competitively influence the cost of medical service, but customers can affect the number of times a service is used. Number of times a service has been used. There are group impacts, personal impacts on premiums through limited patient utilization of services. So there is a group impact and personal impacts. That's how the costs are based on. By segmenting insured lives into like-minded risk classifications, the lower utilization groups will benefit with lower premiums. That's what happens. That's how you can influence. Lower utilization groups will benefit with lower premiums. By segmentation, insured lives like like-minded risk classification, the lower utilization groups will benefit with lower premiums. Keep in mind, lower medical costs through lower utilization means lower insurance premiums. That's what it is, lower insurance premiums. This is, of course, a result of segmenting similar health risks and comparable levels of personal responsibility. Yes, they are comparable of personal response. Remember, again, high-risk groups get government subsidies that lower their premiums. We should not be putting them together. High-risk groups get government subsidies. Lowering personal utilization can also be lower the premiums or out-of-pocket cost to you as a customer. For example, if you have a health savings account, so-called Health Solutions Advantage, you can get rewards for personal actions added to your health savings or Health Solutions Advantage, so-called HSAs. They're personal rewards attached to the HSAs. These dollars, based on personal actions and compliance, can lower the premiums too and offset cost sharing like deductibles, co-pays, co-insurance. They can offset all that. Not only the lower premiums, they can also offset deductibles and co-pays and co-premiums. Lower insurance premiums are the real reason personalized health insurance, so-called customer-based health insurance, risk segmentation is the basis of insurance. Risk segmentation. You have a right to purchase an insurance associated with similar good or bad risk. That's what the risk segmentation is all about. You may ask me why. Because you should be able to share in savings created by the pool's lower utilization services. Yes, lower utilization services. Here is how pooling poor risk in an impaired health support plans will lower the cost for everyone. Here is how. As we have explained before, personalized health insurance places the individual and small groups, uninsurables, into an impaired health support plans. They are grouped into uninsurable or grouped into the impaired health support plans. That means the remaining insured are pool of better risks. So once you put them into the impaired support, the rest of them they are pooled along with better risk with the lower expected costs. Lower expected costs. Based upon the research, at the Employee Benefits Research Institute, so-called EBRI, 1% of group plan members generate 20% of the total healthcare costs. 1% they generate 20% of the healthcare costs. It is this population, so-called this population, that would medically benefit the most from the impaired health support plans. 15% generate 68% of the costs. This is the cost distribution, folks. And 50% generate 95%. So what it does is you're basically Your cost distribution is varied. Moving the population into impaired health support coverages will lower individual policy, will lower the individual policy, and smaller groups contracts cost by a similar amount, which is 15 to 20%. So those wanting lower premiums on plans with higher deductible plans with savings going into the HSA should have these options. Some customers might desire a short-term catastrophic coverage. Everyone should be allowed the choice of any lower premium plan they want. So by segmentation and overall utilization, and you're grouping into the well category, at risk or acute conditions category, a chronic illness category, and catastrophic. As I said, catastrophic, some customers might choose only for a short period of time to lower the premiums. So it all depends on how much coverage a customer is demanding. If you are in the well category, you're segmented into the well category and your premiums are lower. If you are in the at risk or acute conditions category, where people like smokers, hypertension, and obesity, they are at risk for pneumonias, strokes, and several other things related to the obesity. They're at risk. The premiums are based on at risk. Whereas chronic illness, 15%, actually, if you really look at chronic illness category, has only 16% of the entire population, but they generate 48% of the claims. So even in them, you can lower the costs by being proactive and by taking care of these people who need the most care. You can lower the premiums by lower utilizations, and there are ways to lower the premiums in the chronic illness category. Same thing with catastrophic illness. You can lower the premiums in each category. See, some of them you're paying the attention who need the most attention. This way we are not ignoring, especially people who are in the impaired health plans for economic reason, for health reason. You're paying more attention to them by the Health Review Authority. Health Review Authority will, under the public-private partnership, will decide if they are economically impaired, they are given assistance and they are focused on that. And if they are physically impaired for mental or physical health needs, we are paying attention to them. We are not ignoring them like what we do it in the Medicaid. We are not ignoring. We are paying more attention to this segment of the group, and we are lowering. We are trying to lower the cost in this particular chronic illness category. I hope you got my point. By risk segmentation, you're lowering not only the overall cost, and you're also lowering the premium. That's how the risk segmentation, that's how it works, folks. The customer demands. This is our demand-based system. Customer demands price transparency. He demands lower costs. This is what happens in any sector. When a customer demands a lower cost, customers always wins. This is the beauty about customer-driven healthcare or customer-driven health premium or health insurance. Even the health insurance, and they have to be and the customer-driven. They cannot just come up with these numbers. It needs to be customer should be able to shop around which insurance suits the best at a lower premium. If they refuse to buy an insurance, what will happen is if an individual refuses to buy an insurance, they lose all the exemptions when they file taxes. So they have no choice but to participate having an insurance. If they don't get the insurance, they lose all the exemptions as an individual member or a family. Folks, thank you for listening. I hope you got my point. The cost of care definitely lowers the premium ultimately. Consumer is the one who makes a choice. It has to be bottom up approach, not the top down approach. This is Consumers Doctor on behalf of Foremost Organization believes in customer driven healthcare, customer driven health insurance. Folks, we'll continue to talk about customer driven and personalized health insurance and personalized health premiums. If you do like this channel, subscribe, share, and hit that notification bell. We will see you in the next episode. Thank you. Thank you very much. I love you all. Salute. Bye.